Most people assume AI just scans the internet and gives back an answer, but that's not really what's happening. AI is pulling pieces of information from all over at once, a sentence from one page, a detail from another, something else from somewhere completely different. Then it stitches those pieces together into a single response. The problem is, those pieces don't always belong together. Some of them are outdated, some come from a different location, some aren't even from your department. So the system fills in the gaps. And right now, it's doing that with your public health information. That's how an old advisory can still appear active, how guidance that has changed can look like it hasn't, how information from another jurisdiction can show up as if it applies to your community, and how updates can end up connected to the wrong source. Nothing is wrong with what you published. Your website is correct, your advisories are correct. They just weren't built for how AI reads information. They were built for people. Aigistry changes that. Each update you publish is converted into a single structured record, a record that clearly defines what was said, who issued it, when it applies, and where it belongs. Those records are then published into the national AI feed. Technically, it's a structured JSON feed. But a simpler way to think about it is this. Instead of scattered pieces, everything is organized into clearly labeled, consistent entries. So when AI goes looking for an answer, it doesn't have to assemble fragments anymore. It can go straight to the source, no guessing, no mixing, no confusion. AI can use exactly what you published. It can recognize who it came from. It can understand whether it's current, and it can apply it to the right place, so the answer stays accurate. AI is already answering public health questions in your community. Aigistry is how you help it get those answers right, instead of leaving it to guess. For information on how to upload updates or request access to the registry, visit the Upload and Request Access pages.